Hi, I'm Dr. Maria Ilyakova, a bariatric, meaning weight loss surgeon. And today I really want to talk about diabetes and weight loss surgery. Just the other day, I was at the dog park with my dog Sasha, who you can see here. And I was chatting with a friend of mine who works in the development of diabetes and weight loss medications. Even she was really surprised by our conversation when we started talking about the differences between medications and surgery in treating diabetes. When I take a patient with diabetes to the OR for weight loss surgery, I actually stop their medications the day of surgery, and for most people, we never restart them. That should be pretty shocking. One day you're on medications for diabetes, and the next you're not for life? It sounds kind of like a miracle. And in some ways, weight loss surgery is. We don't have any other medication or treatment that's this effective for treating diabetes. There's a lot of media and news about weight loss medications and how effective they are for helping people lose weight. And I'm definitely not here to knock on medications. They have a role, they're very effective, and they can help people lose about 5 to 10% of their body weight, which for many people does the trick. But if you have diabetes and you want to stop taking your diabetes medications for good, it's probably time to consider weight loss surgery. Now, there's a lot of barriers to care. And by the way, when we talk about weight loss surgery, we're not talking about nips and tucks, liposuction, anything like that. We're talking about surgeries like sleeves, bypasses, SADE, and others that go inside to change the shape and function of your stomach and GI tract. When we do this, it actually helps to reset your metabolism in such a way that all of the signaling hormones involved in diabetes are changed, and they're changed permanently. So even for folks who start to regain weight after surgery, which can happen, not lying about that, even for folks who regain weight after surgery, their chances of resuming their diabetes medication or needing treatment for diabetes is much, much lower than if somebody were to regain weight without surgery. So I think it's pretty incredible that we actually have a very effective treatment for diabetes, and it's really underused. Right now, most insurance companies don't let people have access to surgery with a BMI under 35, even if they have diabetes. Even though these surgeries are in the long run, and actually arguably even the short run, they're less expensive than medications. They're more effective, and ultimately, it actually removes medications from your medicine cabinet rather than adds to it. So I hope that this helped to answer some questions about weight loss surgery and diabetes. I'm keeping it short for this episode, but we definitely will get into it a little bit further in detail about how this actually works in future episodes. If you have questions about weight, about metabolism, about diabetes, please let me know. I'd love to hear your comments and your thoughts. I'd also love to hear thoughts about future episodes that we can chat about. So thanks so much for joining me, and I hope to see you again soon.